calling the meeting of the Opioid Settlement Advisory Committee to order. Briefly, before we get started, we'll go around just introducing ourselves as members of the board. My name is Brittany Price. I am in the healthcare payer or funder seat. I work in technical assistance and evaluation for the University of Washington. And I'll kick it over to Lofton.
Thank you, Brittany. I'm Lofton. I work at the North Carolina Harm Reduction Coalition's Durham Student Services Program, and I'm in the person with lived experience seat on the committee. And I'm sorry, but I struggle with seeing
Oh, no, you're
on my
good.
phone who is on Zoom. So if you could pick somebody for me, I'd appreciate
Yeah. Shalisa, do you want to go ahead?
Sure. Thank you, Brittany and Lofton. My name is Shalisa Howard Martinez. I'm with Aging Well Durham, and I'm also serving as the community-based organization representative here on the committee. And I apologize. I will be off camera today. I had a healthcare procedure on Wednesday. Good to be here today, though. Oh, and I will pass it to Karen.
Hey, everybody. I'm Karen Kelly. I'm the Chief Program Officer at TROSA, and I am in the business seat. And I will kick it to Dr. Carter.
Yeah, I'm Jamie Carter. I work at Lincoln Community Health Center doing addiction treatment and primary care. And I'm in the healthcare provider seat. And I'll pass it to Commissioner Jacobs.
Good afternoon, everyone. I'm Wendy Jacobs, and I'm a county commissioner serving in the elected official seat.
Great.
And I don't know who else is gone since I just jumped in, so I'll let you pick somebody.
Awesome. That's actually, you are wrapping that part up for us. So today's meeting, as y'all know, is a continuation of our regular session from earlier this month. Really the main announcement that I have before this meeting is that Shalisa and I talked, and in our next meeting will be a recap of and debrief of this entire process, because obviously this has been a process where there have been a lot of questions coming up and some disagreement among members, and I think that's good and healthy, and we can all talk about it and talk about what we would like to do differently next time. And as well as what went well this year. So that's really the only announcement. We do need to vote to accept the amended agenda to continue with this meeting. And that agenda, basically the only thing remaining, if you don't mind scrolling down a little, is voting on recommended applicants and funding amounts, the remaining ones, and then any agenda items for the next meeting, and then we will be done for the day. And we have until 2 p.m. today, so hopefully we can get through these items in a timely fashion. So I would like to move to accept the amended agenda.
I'll second.
Right, and we will vote. I'm just going to go in order on my screen. Karen?
Aye.
Jamie?
Yes.
Commissioner Jacobs?
Yes.
Lofton?
Yeah.
Shalisa?
Yes.
And I vote yes. So the motion passes. Okay. So if you don't mind, Shalisa, also thank you for being the screen sharer because I'm really inept at it. Do you mind sharing the slides? So we have some slides just to briefly recap what we accomplished earlier this week and what we hope to accomplish today. So let's see. First, what we did earlier this week, We went over these criteria we needed to fund the collaborative strategic planning strategy regardless. We talked a little bit about some of the like frames of reference and thresholds that individual committee members were using to make their own recommendations. And then the next slide. We talked about, again, some of the reasons that folks on the committee decided not to recommend particular proposals or even particular strategies at this time, and talked about some of the partial funding recommendations, where folks called out parts of proposals that they found to be really important. The next slide. So if you will recall, we decided not to fund we voted not to fund strategy 5 or strategy 6 this year. Next slide. We voted not to fund strategy 10 this year or strategy 12. Next slide. And we recommended funding for strategy 1, 7, 8, 9, and 11. These were all recommendations that there was a lot of consensus on when we individually evaluated these proposals. So the next slide, we voted to do full funding for the Department of Public Health and Collaborative Strategic Planning. Next slide. We voted to do full funding for the Department of Public Health under naloxone distribution, as well as partial funding for TRI under naloxone distribution. Next slide. We voted for full funding for the Office of Emergency Services under the Post-Overdose Response Team, which is a continuation, as well as the Department of Public Health proposal of previously funded programs. Next slide. We voted for full funding for the Department of Public Health under the Syringe Services Program strategy, as well as the North Carolina Harm Reduction Coalition. Next slide. And we voted for full funding for the addiction treatment for incarcerated persons in the Sheriff's Department. Again, this was a continuation of previously funded programs. Next slide. So, this was part of our recap. We did recommend allocating 2.2 million as the total for the funding for next year. Next slide. And then we have created a committee totals spreadsheets, Shalisa and I, and we put in all of the funds that are like the recommended funding amounts for all of the fully funded proposals that we had. So those all added up to about $1.5 million. So we still have about 600,000 left to allocate.
Hey, Brittany, I just want to
Yes.
jump in. I just have a quick question for you, just to clarify, just for the record. When you said vote, are you saying you guys voice voted for all of those areas for each applicant, or are you referring to the count that you received?
These were from the last meeting from Monday. So we had voted to fully fund. Is that what you're from the previous meeting?
Yep, that's it. Yeah.
Okay, yeah. This isn't all we haven't gotten to the ones that we still.
No, I'm talking about
Yeah.
the one that you're referring to now. You said that you voted on those. I was just trying to make sure for the record, so I have the minutes correct.
Oh yeah, of course.
Yes.
Yeah.
And that's actually, Jason, I was as Brittany was going through that, I realized that the language was incorrect. We should have actually put in there that the vote for the proposals that the committee recommended earlier this week. So we'll make that edit to the slides as well.
Oh, that would be perfect. That way people can understand that these were preliminary, in the background, and then you guys came forward and did the actual voice vote.
Voice vote. Yeah, that's
Awesome.
great.
All right. Thank you guys. Appreciate it.
Yes. Yeah, of course. Great. Okay, next slide. So today what we are going to be doing together is we need to recommend a funding amount for TRI, which we voted last week to recommend partial funding for the naloxone distribution proposal. And then we will vote on our recommendations, whether we recommend funding strategies 2, 3, and 4, and if we recommend funding anything from those strategies, which proposals we would recommend. All right, so now let's take a look at, we have a spreadsheet. We have a giant spreadsheet in our shared drive. Should we take a look at the committee totals spreadsheet? Let's see. Yes, Karen.
So I want to put in a thought out there that might be a motion if people are in alignment with this. So last meeting, we voted for full funding for those things that you just had on that slide.
Mhm.
And we also voted to recommend the increased funding to be $2.2 million.
Mhm.
And I'm wondering if it would make sense, if people agree, to have a motion saying that if the increase does not go to 2.2 million, that we still recommend full funding for that 1.5 million that we just had on that slide, because the ones that got the most consensus around full support add up to about the 1.5 million budget. I don't know how people feel about that or if that made sense.
Yeah, do folks have thoughts about this? About making a recommendation that's sort of like a kind of like a caveat that if we do not get 2.2 million, that the commissioners prioritize funding the projects that we approved for full fund, or that we recommended for full funding earlier this week.
I agree with that approach.
Okay. So do you want to make, Karen, do you want to make a motion?
Sure, I'll try and make a motion. Before I make my motion, though, I saw something in the chat and I meant to say it as well. And I want to give a public shout out to Brittany and Shalisa for doing so much work in between these meetings to help keep this process moving forward. So, and Jason too, I'm sure you've been putting in some time. So before I make my motion, I just wanted to say that. Okay, so the motion would be that if this committee's recommendation to increase the funding to 2.2 million is not adopted by the commissioners, that we are recommending that the 1.5 million, and maybe in the notes it can be clear on what slide I'm referring to, that slide that we just had consented to last meeting becomes the recommended full budget, and that we're not recommending that the larger budget that we're about to recommend gets chopped up.
Well, is there a second?
Second.
Okay. So we'll do a voice vote. And I'll just go in order on my screen. Karen,
Yes.
Lofton,
Yes.
Dr. Carter,
Yes.
Commissioner Jacobs,
Yes.
Shalisa,
No.
Okay. And I vote yes. So the motion passes. Okay. We will look now at the remaining strategies and proposals. Let's see. So this is a spreadsheet that Shalisa and I worked on where we, in green, are the amounts for like fully funding the strategies and proposals that we voted on Monday. And in orange, we'll get into this, are the amounts that are the median amounts of recommended funding for proposals where there was a consensus support from individual kind of preliminary work among the committee for partial funding. So what I would like to do is first look at try, because we've already voted to recommend partial funding for them. This is how I calculated the median. Just so folks know, I copied everybody's try line from their spreadsheet, their own evaluation spreadsheet. And so we see here the recommended amounts, and then we have a range of recommended amounts preliminarily from $38,542 to $73,410.50. To calculate the median, I just put the median formula in, and I calculated it two ways. The first way is just including the amounts that folks recommended for partial funding. The second way was including if there were proposals where there had been a vote not to fund, and counting that as a zero. So it's calculated two ways. The other caveat that I'd like to share that occurs to me when I look at this particular proposal is wanting to make sure that we know that the things that like were important to the committee about this proposal will be able to be funded at whatever level we decide on. I'll pause there if anyone has thoughts or input. I can also open the budget for this particular proposal. Let's see.
Brittany, I wonder if, because I think as a group there was some consensus that we wanted to see existing programs continue to be funded at a high level. And I'm wondering, I think the only one that wasn't recommended in our meeting last time was the RI's proposal with the
Okay,
community
yeah.
linkages to care. I don't know if it would be helpful to talk about that first and kind of to figure out the level of funding that we would recommend for that program, if any, and then just because it
Yeah,
seemed like we had sort of a preference to prioritize existing programs
that
and then
works.
look at the other programs that would be sort of newly funded programs.
Perfect. That sounds great. So I will show you, here's the spreadsheet. So here is the same type of spreadsheet for the Recovery Innovations proposal. And there was a split between full and partial funding. There was one recusal and one do not fund. So let's see. For the 2.2 million column that we're working with, the full funding amount would be $370,321. Some of the comments spoke to committee members like desire to prioritize. Oh, I'm realizing that I'm looking at this through. There we go. Okay. To prioritize existing programs. And I guess I'm curious about if folks have thoughts about what level to fund this at, if folks are up for full funding, if folks want to think about a different number together. The median recommended was very close to the full amount. 369,860 or 369,721.
This is Lofton. Sorry for my math brain. If we decided to recommend the full amount for this, how much would be left in what we before we reach our 2.2 million cap?
Let's find out together. um, okay, so that was.
I think it'd be like close to 300,000, a little bit over. But you can go and do the math because my math is terrible.
Okay. I'm just gonna shift these over to the next column. Actually, just for right now. And then the RI, if we did full funding, we would have, yeah, close to 300,000, like Shalisa was saying. Yes, Commissioner Jacobs.
I would suggest that for all of these subsequent decisions that we're making now, since there was, not as strong consensus, that we use the same decision-making process for all of them. So when you were saying you were taking the median amount to be, I think just to be consistent, my suggestion is that since these were ones that it was not the same as the ones that we voted on the other day, that just to be, I think, kind of fair and consistent, I would suggest that. But
Okay.
that's just my suggestion.
Right. Does anyone else have thoughts?
Yeah, I'm curious if we do that median amount, where that gets us. Does that get us to 2.2 or is that above 2.2 or
It
below
does.
2?
It takes us over, which is something we could talk about because not all of these had the same amount of support for partial funding. In particular, let me see. Yeah, so not all of them had the same level of support. 1, 2, 3, 4.
Is it possible to look at the ones that had the most support first?
Yes. Yeah. So I think I put them in order. Let's find out. Okay. So we have already voted to do partial funding for. BART received 1, 2, 3, 4, 5 suggestions of partial funding, 2 suggestions of full funding. RI received 3 suggestions for partial funding, 3 suggestions for full funding, and 1 for do not fund, 1 recused. Then when we get to housing, there was more of a split. So there were 2 suggestions on Oxford House for partial funding, 2 for full, and then 4 do not fund. And then Southlight had 4 suggestions for partial funding, 5 for do not fund. Right, 2, 4. Oh no, 4. Yeah, sorry, there were 4. There were 8. So 4 and 4. So when we look at these, oh, the other one that I ended up not doing this for was we had the other one that we had a lot of support for was the Justice Services Peer Support Specialist. And that was, if we go through, we had here, I'll stop the share and we'll look at the counts. So for that proposal, why is everything running? Okay, we had 4 recommendations for full funding, 2 recommendations for partial funding, and 2 for do not fund. So 4, I shouldn't say recommendations, 4 suggestions for full funding, 2 for partial, and 2 for do not fund. So of the proposals that we're looking at today, that one received the most full funding recommendations at 4, and which put their median right at the their full funding amount. So that would be one, I guess, if we're looking at which ones had the most support, even before RI, that one had significant support. And that was for 802 or 82803.
Is that the one that there was a thought might be funded through another route?
As far as I know, no. Commissioner
Okay.
Jacobs might be able to correct me.
I think the family treatment court is what you're thinking about, Karen.
Thank you. I like the idea that I think Wendy was suggesting of starting with all the ones that there was a mixed reviews, going with the one that start at the top, the ones that got the most support, and working our way from there. I think is seems like a good process.
Okay, so that one had, of all the ones with mixed reviews, that one had the most support. Well, of the it had the most full funding and then plus 2 partial funding. There are some that had 2 full funding, 5 partial funding, and so then it gets one that had that actually. But this is this one had the most support out of all of those.
So is the idea that we do median for the ones with the most support and until we are getting close to our budget max? Was that the
That was
proposed
the
idea?
recommendation. Yeah. And let me just make sure that we should really have a spreadsheet for this because we have one for all the others. So I'll do that real quick. Justice Services. Sorry, y'all. So again, let's see. Mm. Seven and then 8. Okay. Thanks for your patience. Okay. So we have, whoops. Okay, we have, let's see, sort this from smallest to largest. And then, so we'll have, so 82,803 is the full amount, and that's the median if we do not count the do not funds as zeros in that calculation. If we do take that into consideration, then through 7. Then it comes out to $78,106.75. Does anyone have a preference for which calculation to use? I lean toward the one that doesn't include the zeros in the median calculation, because I think if we're going with partial funding, it makes sense to go with amounts that were suggested rather than pulling it down with the do not fund suggestions, but I'm also open to doing it a different way. And we have like 25 minutes left together today. So if folks have thoughts.
I guess yeah, I think if we pull the number down too much with zeros, like for this one in particular, it's basically just funding one staff person. Like if we got it, if we funded half of it, like I don't know that they would be able to do the project at all
Right.
unless maybe they could hire someone part-time. So to some degree, we have to keep that type of thing in mind, at least for this project. But yeah, it's hard to know. It feels a little arbitrary either way, potentially, but I think, yeah, if we're consistent, that sounds good. Should we just like tentatively decide or tentatively, see if there's consensus about kind of the median funding on this one, and then look at the other levels for the other more highly supported projects, and then circle back and kind of make sure it isn't over the limit, or
Yeah, that sounds great.
because yeah, I think I'd be in support of the full funding amount, which is also the median amount for this one.
Okay. Is anyone in disagreement with tentatively putting the full funding amount for this one in the spreadsheet? And moving along.
No, I'm fine with that.
Okay. Cool. So great. So there's that. Then RI was the next, had the next amount of support. So if we were to do median funding for RI, which would be consistent with what we did with the last one, then that amount would be 369, 860 and 50 cents. Does this feel good to folks to tentatively put it in the spreadsheet? Great. All right. This brings us, okay, we have about 210 left, just so we know that. And then when we look at the counts.
Wait, quick question, Brittany. Have
Mhm.
you already accounted for the funding for TRI?
No,
Is
we have not. We have not put in the funding for TRI yet.
Well, I think that has to be in there because that was already approved from the
Right.
previous.
the other
So
day.
that needs to be in there.
Great. So let's do TRI next. So when it was recommended for partial funding, when members made the suggestions individually in their spreadsheets for partial funding, these were the amounts, which made the median 50,000. How are folks feeling about this?
And it includes the same method as used for the last one, Brittany?
It does. Yeah, it's the same method. The one on the right for each of these is the median that includes the do not fund as a 0, but then the 50,000 is the median from the suggested amounts. Wait, where's? One second. Let me look. That was incorrect. I'm sorry, y'all. I thought that I had counted correctly, but there was one missing. So I'm putting it in. Nope, that's a different one. Wrong thing. Okay. Sorry about that. For all of them, as we go through, I would love if I could have someone check behind me just to make sure we have input from 8 folks on the median calculation. Okay. So now when we have this, the actual median, this makes a lot more sense. Is 35. Okay, 61,705.25. And okay, so the median would be 61,705.25 calculated the same way.
That seems consistent. I'm in favor of putting it in at that.
At that amount. Does anyone else have thoughts? Great. All right. Oh, hold on. That's because I copied the formula. 61,705.25.
My only concern about that amount is looking back at their budget. Most of it is for personnel. A lot of it's for personnel. And I just wonder how much would they be able to actually implement this program? Um,
Yeah.
yeah, I'm just not sure about if it would be enough for them to actually be able to implement the program, even if it was scaled down a bit. So,
Mhm.
that's my only concern about that amount.
Yeah. Karen,
Yeah, I'm glad you brought up. I personally would rather fund fewer things well.
yeah.
Um, I'm a little worried about like if you know, I don't know what it's going to look like when we get through some of the other ones that received partial votes.
Mhm.
Um, and maybe it's better to give more money to the agencies that had more overall support as
Mhm.
opposed to like because it seemed like if correct me if I'm wrong, but I think these were the three that were kind of the second tier. We had the first tier, which was like they
Mhm.
were almost all
Yep.
full supports, maybe one that wasn't a full support, but mostly pretty strong consensus. And
Mhm.
then these next three, I think, were kind of a significantly different tier
Mhm.
than the is that true?
It
Well,
is. Yeah, that
well,
is.
try the committee voted to recommend try for funding on Monday.
Mhm.
So
Yeah.
Right.
they're kind of like in the middle. I wouldn't say they were second tier, but
Gotcha.
yeah.
Gotcha. Yeah. Tier one. Well, yeah. Yeah. So maybe it's try and the tier two we're funding at like uh more instead of giving more
Mhm.
people. I'm just in agreement with what Shalisa's saying that
Okay.
cutting people's funding a bunch could create not product,
Yeah, I
useful
agree.
work.
Um, go ahead.
I
Go.
will say that just one thing to think about with that is that I guess the county's numbers that they had come up with were 75,000 for a try. So I don't know if we can assume that there was some conversation with them that that would be a useful amount of money for them that they could do some work with. I'm not sure about that, but I maybe would think that would probably be true.
I can speak to that, Jamie. Yeah, so thanks for bringing that up. Those was kind of like fictitious numbers. Those were not recommended money funds from the county. That was just a scaled out suggested figure. So that's all.
Okay. Um, how about we look at the budget? Does that sound good? Like at it tries proposal, their proposed budget, and then we can
Yeah, I
see
think that's a good
what
step because most of it is personnel.
great. Yeah, let's take a look. Doo-doo-doo. Thanks for your patience as I do my searching. All right. Gotta get the folder. If anyone else has it handy, then I'm also very happy to cede the screen share to whoever finds it first.
I have it, but for some reason I cannot share. So it's
Oh, yeah.
yeah, because you're sharing. Okay, I got it.
Okay, yeah.
Yeah, let me
You should be good now, I think.
okay. Here we go.
Great. Okay. Yes, so it was 173.5 overall for personnel, including 50 for executive director, 40 for a half-time program supervisor, 6 for a bookkeeper, 120,000 for health ambassadors, excuse me, with lived experience and cultural grounding, 17.5 for the fringe. And then there was some technology, training materials, some website,
Oops,
social media. Oh, go
sorry.
ahead.
No, I just want to make it bigger. Sorry.
Yeah, yeah. And then the naloxone expansion. It was 55.
I guess I felt like this project, it was unclear to me, and I think this is going to be really important for future reviews. Like what staff already exists and are in place? Like what's new work, or like what's new positions, kind of what's already funded and like what's expanding on where, because this looks like it's kind of just like setting up an entirely new program from the ground up, but I also didn't think that that was really the case with Tri. I thought they were already doing this work, so I just felt like it was a little bit hard to evaluate what would be if we're doing partial funding, kind of what would be a reasonable amount without more details on that. It's not even clear to me really from the budget, like what's funding like the naloxone itself. Is that the naloxone expansion piece, or is that just about community events, storage, replacement, outreach? Maybe that includes the naloxone. But yeah, I found this a little bit confusing. And so I feel like it's hard to know.
Does anyone else have thoughts about where to begin with like an amount for this proposal?
I mean, I guess I'll jump in again. If we're looking at like the direct work of the naloxone distribution, then it seems like we would want to be funding at least some of the health ambassador positions, and then whatever funding is needed, like for naloxone and supplies. So I guess like that could be up to 120,000 for the health ambassadors. And then the naloxone piece, I think, is listed at 55,000, although I don't know exactly what that includes.
Yes, Commissioner Jacobs.
I just have a question for Jason. Jason, related to the opioid settlement, does it give any guidance about funding new services versus existing, or supplanting funding for existing operations versus new? Is there any guidance?
Yeah, great question, Commissioner Jacobs. It's pretty broad to be quite frank with you, just around that. But the guidance, honestly, a lot of the programs it says words like expand, support. These can also be new programs as well. Like the public health harm reduction program, that is a new program that we built from the ground up. So very, very similar approach. But the goal is that we think about with these funds is how do we sustain those programs overall? So I think that kind of comes into it. But to answer your question directly, Commissioner Jacobs, there's no clear guidance around we can or cannot fund new or existing programs. One of the things, though, that I will say that is clear is that we can't start an organization with these funds. So, like, they have done like no work. We can't. This is not startup funds, and we've had some conversation with some organization around that. We can't do that because obviously we want to sustain an existing organization, help expand an existing organization. But the only thing I do know is clear. Once again, I'm reiterating, not startup funds, like for like a new organization specifically. So hopefully that helps a little bit. I'm sorry.
Yeah, thank you, Jason. So I guess
Yeah, I mean, I'll propose that the recommended budget amount be to cover the personnel costs. Because again, I feel like, and then like Jamie said, the naloxone expansion materials, because that is the main work of this proposal. And it's also the strategy that we've already voted to recommend.
Yeah.
So
Shalisa, would you be recommending the total 173.5 personnel or the 120 of the health ambassadors?
I would say the whole 173,500 and then the 55,000.
Okay. How is that for folks? I think, let's see. It looks like we do not currently have that entire amount available. With these recommendations, we have $210,599.50 remaining. So I'm curious about, does this proposal say like how much time? Well, the we would have the halftime with the super manager. And then how much of like the program director's time and I guess I'm wondering if there's a way to fund I was gonna say like health ambassadors and naloxone. Um,
I don't think the proposal says like how many FTEs, like for example, the program director and the
yeah,
well, the supervisor does,
yeah.
but it seems like just the explanation you would need to have the program director and supervisor
Mhm.
involved if you're going to fund the health ambassadors.
Right.
Can I ask a clarifying question, Mrs. Lofton?
Absolutely.
Brittany, when you said that we have the 210 amount remaining to work with, you're basing that on the sort of preliminary median-based calculations we did for those two other
Correct.
ones earlier.
Yep.
My feeling and my suggestion is, and I can make a motion if that's helpful, can we set those aside for the moment and then go ahead and vote on our recommendation for try, since we already approved try on Monday, and then
Mhm.
work on the other ones?
I guess my understanding for why we voted on try on Monday was not that it was at a higher level of consensus, but that it came under the recommended strategy of naloxone distribution, and so we had already discussed it, but not necessarily that like we're prioritizing it over the other proposals that are sort of in the mixed support bag.
I see what you're saying, but they were falling under the strategy that we decided to.
Yeah, we
Whereas the
definitely have
other ones are under.
partially
Yeah.
fund. Yeah, so I'm not saying we shouldn't vote on that, but yeah, I
Yeah,
don't think it was necessarily that they were like a higher priority among the group than the other proposals we're talking about today.
correct. Yeah, we had try had 4 folks individually supporting it for partial funding, um, and 1 for do not fund. And then there was 1 blank and 1 recusal. But the Department of Justice Services had 4 for full supporting 4 full funding, 2 supporting partial, and 2 saying do not fund. Recovery Innovations had 3 and 3, full, partial, and then 1 person saying do not fund and 1 recusal. Um,
I mean, since we're pretty close to time, I know we don't want to rush, but I definitely if Lofton's willing to make the motion, I'm willing to second his proposal of us figuring out this and then moving on from there.
okay.
Sure. I make a motion that we go ahead and do a voice vote for our recommendation for try that fall under the naloxone distribution strategy that we already voted to.
And I second.
Okay. So voting on whether
I'm
we-
sorry, I have a question
Yeah, Karen.
before we vote. Lofton, at what level of partial funding was your motion at?
Oh, I did not get that far. Sorry if this is too granular, but I was thinking, can we just, can we go ahead and decide try first, basically, before we move to the other ones, was my thought.
Mhm.
I
Okay,
guess it would be helpful to know what what exactly we would be voting.
sure, yeah. Well, we have a motion and a second to talk about try first. Um, I'll go in order. Karen,
Yes.
Jamie,
Yes.
Lofton,
Yes.
Shalisa,
Yes.
Wendy,
Yes.
and I'm a yes. So, okay, let's decide.
I'll throw a motion out just as a point to start a conversation. How about that?
Okay.
Maybe it's not a motion, maybe it's just a thought experiment, which would be to fund it, I guess before I say it, I'm going to want to put a little pinpoint in this, and I think that it's important for us to like note how hard this moment is, and that we should talk about this and the way we're crafting the RFP to make sure that we're asking the right questions to help us make future recommendations. So setting that aside, I'll just say that I'm wondering about partial funding be like think through this budget in terms of having 2 health ambassadors, which would probably mean, you know, less administrative oversight, but maybe the same amount for the website and data management and that sort and naloxone.
Yeah. I was
I feel like we have to have both personnel and materials
Mhm.
somehow in there.
I agree. I the number that was coming to mind for me was something similar, was 120, which would cover 2 health ambassadors, and then one, it would cover the naloxone expansion. There would only be 5 left over though for everything else. I guess I'm thinking in like it would be in relative alignment with like how we've said that we would look at other programs, like if we think, I guess like, or perhaps more in alignment if we consider that like that most folks or that everyone who supported funding this program supported partial funding. We said partial, although all of personnel and supplies would still be partial. I guess what I'm saying is I like this idea of looking through and saying, okay, if we were able to fund essentially half of this program, what would that mean?
And I have a quick question for Jason, maybe. Are these projects that now required to build back to line item budgets or not?
Hey, Karen, say it again. I'm sorry, so I can understand your question. I'm sorry.
Yeah, sure. I just want to make sure that, like, I'm asking if once these are approved, if the organizations have to bill to these line items that are in their budget or not. In other words, if we say we want to fund 2 of this and 1 of that, do they still have flexibility to get work done in a way that makes sense? I'm just worried if we are too specific in how we dissect this funding that we're then locking them into like we're not experts in their project. And I don't want
Yeah,
to lock them into a strategy that won't work.
Yeah, I'm not exactly sure you guys could do that. So one of the things that would happen is if when you guys recommend the funding, it would have to align with the county's budget system. And then we would have to look at our internal controls just to see, how they can move money around. We typically don't allow that within our contracting, within public health in general. But it has happened, but we're still fine tuning this because we're still very early in the game with that. And so a lot of the projects we've only had one contract that we've done so far, that has been RI. So it's been pretty smooth and easy to how we've, been able to do that. And that question has only come up once with them and that. So we are still defining and rolling out those type of internal controls, but whatever you guys are recommending, and if this is approved, by the commissioners, it then has to align with our contract process and also has to align with our budget line item projects. And then thanks to your other question too, these line items specifically, that will also have to filter through the NCMOA, which once again, some of these may be in alignment and some of these may not be in alignment as well. And lastly, via the RFP, I have reached out to organizations to see what around this type of issue, which is the notification out loud was for everyone to scale down their budgets just to have that amount. And then if they were approved, then I would then kind of work with them around what's allowable and working on their project implementation. So hopefully that helps out your discussion a little bit more and hopefully answers your questions.
Thank you.
Yes, Commissioner Jacobs.
Well, just getting back to what I think Shalisa was trying to propose, and knowing that I think the amount was like 228.50 that we had left, and based on what Jason just said, is that, the details would really need to be worked out between Jason and whoever the applicant is on all of these contracts. So making sure we're following all the rules and, everyone being, I think, mindful of knowing the dollars are limited. So I guess one possibility would be for us just to allocate that remaining funding that we know that we have the 228.50, and then, letting those things be figured out as part of the process. So that's one possibility.
So, okay, yes. So it sounds like there is support for funding TRI at 228,500, which is that's the amount that would be personnel plus supplies. And that would we would need to do some adjustments on the preliminary numbers that we had said. Otherwise,
oh, I'm sorry, Brittany, how much did you say would be left?
It was the 210,599.
Oh, okay. So maybe I got mixed up. So doing at least the 210, whatever we had available to put towards the personnel and the supplies or whatever. Actually, it wouldn't even be up to us, right? It still would be up to TRI working with Jason on what they think they need to be effective within that amount. So I'm sorry, I got mixed up with the numbers.
It's okay.
I agree with that.
Okay.
This is Shalisa.
Okay, so I'll put out a motion to allocate the 210,599.50 to TRI.
Can I just say before, is that okay? I'm going to vote no on this.
Okay.
And I just want to say that I think the reason is, for me, is that I think I feel like there were some other proposals such as BART that got a comparable level of support and won't be getting any funding. And I think that this, allotting 200 plus to TRI is not consistent with the median that we used for the other, it's not consistent with that process. And to me, this proposal wasn't clear enough. It wasn't clear enough in looking at their budget and their proposal, kind of what the need was with, the different pieces of the funding and whether that would be new work or taking over paying for existing work. I would definitely support a lower amount for try, such as the 75,000 that was originally kind of suggested. And I think something like that I would imagine could still be useful to an organization that's already doing existing work. So to me, it doesn't feel as important to make sure that we're funding all the pieces of their proposal, since we know that they're already doing existing work and we don't exactly know how the funding ask fits into the exacting work. So to me, it's just impossible to really make that recommendation. So I just wanted to say that before I vote no on this.
Cool.
Brittany, based on what Jamie just said, what was BART the next highest rated?
So looking at yes, so BART was a little higher. It was rated with two folks suggesting full funding, 5 folks suggesting partial funding.
Okay.
And try was 4 folks suggesting partial funding.
Okay. And what is the amount that would come out with the same decision making, the median?
So for BART, it would be 87.5.
Okay. So, okay.
Could I ask that your spreadsheet that's got the median amounts in it get put up there? Because I don't know where we are in the budget if we use the consistent process. And Jamie, I appreciate you reminding us that the reason try was sort of got a partial got voted on in where these other ones didn't, was more about just where they fell on the spreadsheet than in our time in the meeting, and not because more people voted for partial or full funding. So I think looking at the overall budget with using the same system as we used for people who got mixed reviews, what does that total get us to?
So if we use the same, then do you mean including like the same logic for try? Or not including? Yeah, okay. So if we were to use that consistent decision making, oh my gosh, I'm so sorry. I keep copying formulas. Sorry. Okay. Okay, so that would give us another 61,394.25 in the budget. We would still have some funding left. There was let's look at the counts. So in the members' suggestions, the next sort of level of support was for recovery housing support, and that was similar to the amount of support there were for try. There were 4 folks suggested we partially fund Southlight. 4 said do not fund. 2 folks suggested we fully fund Oxford House. 2 suggested partial, and 4 suggested do not fund, which actually has more dissent than try. So if we kept it, I guess what I'm saying is that if we kept this consistent and allocated these median amounts to the partial funding folks, there would be 61,394 as variance. That I actually don't know. Are we able to roll that over to another year, Jason, or is that something that has to happen in the same year? I'm just trying to understand like all of our options.
we can't do no rollovers, unfortunately.
Okay.
Yeah.
Okay.
Brittany, between the 2 housing options, which ranked higher in terms of the recommendations? And what would be the median amount is that in the orange?
Yeah, that's in the orange. So
Okay, okay.
the main, okay, so for the housing, Southlight received 4 recommendations for partial funding, and Oxford House received 2 for full and 2 for partial. And then the medians for those would be the 142.5 for Oxford, which would put us a little over. The median for Southlight was 215, which would also put us over. Yes, Karen.
Seems to me that at the end of the day, there's going to be a little bit more than that 60 whatever left, because I think, based on what I understand Jason to be saying, some of the things that are currently in these people's budgets probably might not get to be funded, and there's going to be some like math needing to happen.
Mhm.
And that at the end of the day, there may be a little bit more than this. And I just wonder if there's some um, kind of way that uh, that it goes to one of these housing agencies, that it's kind of like whatever's left over. Because I think at least one of them, it wasn't capital for housing, it was like rent supports, if I'm correct. And
Yeah.
other people
So,
might remember. And it seems
yeah.
like that's a thing that you can have a fair amount of flexibility around, right?
Mhm.
So anyway, that's a thought that we might want to do as far as allocating any remaining funds, the
Mhm.
66 plus anything that shakes out of these trees when Jason does his work,
Mhm.
be awarded to one of the housing agencies.
So Southlight was the housing payments, and then like for individuals for their patients. Um, Oxford House was housing. Catla was setting up 2 new Oxford houses.
Okay, then my proposal would be that it would go to Southlight to offset housing, because that is a thing, you can't buy a house with $50,000, but you can help offset housing costs for other
Right.
people with it.
Yeah.
And just to be clear, just to jump in, just to help you out, Southlight's proposal was for a peer support specialist. It wasn't actually around housing, even though I believe there's one under the housing support. But once again, because everyone's application was split across multiple strategies, theirs would actually fall under the recovery support services, just so it's clear.
Oh, Jason, I thought it was a peer support specialist and like,
They had an operational cost component to it, yes, as well. Yes.
or I mean like rent for, I thought that there were line items for like rent.
They did. Yeah,
Like
that is a part
maintenance.
with the Oxford House. That was a part of Southlight's. Yeah, you're right. That is a part
Okay.
of it.
Okay.
Yeah.
Yeah, that's I think that's my proposal for this remaining funding, is that it be uh, awarded to Southlight for helping people with rent.
Do we have other thoughts on that?
Yeah, I support Southlight getting some funding to help people with rent. I'm I'm confused about where the number we're talking about, that's the amount that's left is coming from.
Oh, this is a great question. It's down here under
Uh-huh.
variance.
And so that's
So
assuming we've already, sorry, go ahead.
oh, so basically, okay, so the things in green are the fully funded things that we talked about earlier this week. The things on the right-hand side are basically where I pasted things so that I could pull them back over if I needed to. But the 87.5 would be for BART. The 82.803 was like the Department of Justice Services. It would be the median for RI, the 369, and then the median for TRI, which was like the 61. And
Gotcha.
so if we were to do all of those medians, then we would have
Then there
the
would be that left, and then that could
Mhm.
go to Southlight for rent. Yeah, I support that.
Okay. Shalisa, yes.
No, I was gonna make a motion that we
Cool.
vote on this.
Great. I second that motion. So, sorry, Shalisa, was that including like putting what's left to Southlight?
Yes.
Okay, cool.
Yes.
6139425. Okay. So, and Christy is off the call. Jason, do you remember, do we need to vote on each strategy individually and then each proposal under that strategy?
I think no, not necessarily.
Okay.
I think each person just need to vote per I guess the applicant that you guys are recommending and the amount,
Mhm.
and you guys can just do a voice vote on that. That way it'll be for the record, and we'll move forward.
Okay, thank you. So I propose a vote on allocating $87,500 to BART under the evidence-based addiction services strategy. $369,860.50 to Recovery Innovations under Recovery Support Services. $82,803 to the Department of Justice Services under Recovery Support Services. $61,394.25 to Southlight Healthcare under Recovery Housing, and $61,705.25 to Try under naloxone distribution. So, sorry, that was a
And
long.
that is it. Just to be clear, that is in addition to the allocations that we've voted on earlier.
Yesterday
Okay.
or Monday. To
Monday.
me, it's
Yes.
yeah. What is time?
I'll second that motion.
Okay, great. All right, so let's vote. Jamie,
Yes.
Lofton,
Yes, sorry, struggling.
oh no, you're okay. Commissioner Jacobs,
Yes.
Shalisa,
Yes.
and I vote yes. Karen,
Yes.
great. The motion passes. We have recommendations. Oh my goodness. Thanks, everyone. Thanks for your patience. Thanks for sticking with us. We're 20 minutes past. Thanks, Jason. Thanks for your patience. What a process.
This is what we do every day, all day. So I'm glad you guys got a piece.
Cool. So next meeting, May 11th, Shalisa and I might send out an email because again, that will be the one where we debrief this process. And we talked about potentially trying to do that meeting in person just because sometimes when emotions are high, it's, it's a little easier for in person to talk about this stuff. So be on the lookout for that. Yes, Jason, thank you so much for your guidance and patience. And with that, I would like to make a motion that we bring this meeting to an end.
Second.
All right, let's vote. Karen,
Aye.
Jamie,
Yes.
Lofton,
Yes.
Shalisa,
Yes.
Wendy.
Yes. Have a good weekend, everyone.
Have a great weekend. I vote yes as well. Congrats. The
Yes.
month-long meeting is over.
Thank you, Brittany and
Thank you,
Shalisa.
Steve.
Thank you,
y'all.
everyone. Thank y'all so much. Thank
Thanks,
you.